Hi, my name is Maggie McGill, and the film that I decided to review for my movie review was Still Alice. This movie dives deep into the life of a middle-aged college linguistics professor, Alice, who was diagnosed with early onset Alzheimer's disease. I really liked this movie because it showed the impact that this disease can have not only on the patient, but their family and their support system as well. It's really easy to learn about certain diseases in school, but seeing an actual person struggle with their disease and attempt to overcome it brings a different understanding and sense of empathy towards the topic. Alice started displaying her symptoms very early on. She began losing her train of thought when lecturing. She would get lost when going for runs in previously familiar areas, and she wouldn't remember things that had already been told to her. When forgetting certain things, she would blame it on exhaustion, aging, or drinking too much champagne. But once she reached a certain point where she was forgetting basic facts frequently, she decided to visit a neurologist because she thought she might have a brain tumor. The doctor had mentioned that her memory issues might be related to going through menopause, but once he asked her multiple questions and had her repeat random words, her lack in ability to complete these tasks led him to believe early onset Alzheimer's disease was the cause of her problems. The neurologist had Alice return for an MRI and a PET scan and told her to continue to exercise, play memory and word games, and consume lots of water in the meantime to help her brain with its memory function. When she was diagnosed, Alice began taking Aricept and Namenda to help decrease her symptoms associated with Alzheimer's. Alzheimer's is an incurable disease that uses medication as a way to slow the progression and lessen the symptoms, but ultimately it won't be able to cure the disease. So even though she was setting reminders and consistently taking her medications, her condition began to worsen. This was shown by her continuously reintroducing herself to her children, putting shampoo in the fridge, struggling with sleeping, so she had to take sleeping aids, having to write down the answers to basic questions like her birthday and her oldest daughter's name so that she could remember these things when asked these questions, having to retire early from her job, and needing to highlight her papers as she read them so she wouldn't lose her spot and need to repeat the same sentence. Her condition also required her to wear a medical bracelet that said memory impairment, and she needed constant supervision either with a family member or a home health nurse in order to prevent injury. In class, we learned that the cause of Alzheimer's disease is very controversial and can be related to either genetics, neuronal loss, hormones, brain atrophy, or neurofibrillary tangles. There are 4 A's that are associated with this disease, and these are apraxia, which is losing the ability to perform learned movements, aphasia, which is losing the ability to speak or comprehend other senses, agnosia, which is being unable to identify objects or people, and amnesia, which is the memory impairment. Like I mentioned before, medications are used to slow the progression and manage the symptoms, but not to treat the disease. The main medications included are acetylcholinesterase inhibitors such as Exelon, Razidine, and Namenda, which prevent the breakdown of acetylcholine in the brain. The effective milieu for a patient with this situation would include ensuring the patient's safety and comfort by observing the patient's preference of temperature, lighting, and noise. It's also important to include memory aids, calendars, illustrated large print directions, and notes to limit the factors that could confuse these patients. I've learned a lot from this movie that I can implement in my future career as a nurse, but I feel like the main thing that stuck out to me was to make sure that the family of the patient is involved in the care and is also being supported as much as the patient. This is so important and can help the patient stay comfortable and increase their ability to cope with their disease if they know that their family is in a good space and willing to help them and be there for them. The primary nursing diagnosis that I would give to Alice would be that she's at risk for injury due to her disturbed thought process and chronic confusion. My recommendation for Alice and her family would be to make sure that she's never left alone without supervision, and she has written signs or pictures displayed all over her house to decrease her sense of confusion and help her understand the things that are going on around her. I would also recommend that she spends as much time with her family as possible so her and her loved ones can experience these good memories as long as they can.